Good afternoon, everybody. Thank you for joining us on a Friday afternoon, nonetheless, a very warm and sunny Friday afternoon, for our final session of our North Country Telehealth Conference week. It feels like literally a minute ago, it was Monday morning and we were starting our first one. So our theme this year is Uniting the Future of Population Health and Virtual Care. This is a theme we created pre-COVID. I feel like that future is most definitely here, and we have some exciting presenters today to talk about some more specialized work that they're doing in this space. My name is Katie Cook, the Telehealth Project Manager for Adirondack Health Institute in Glens Falls. We are bringing these sessions to you this week from the North Country Telehealth Partnership. That is a joint effort between AHI and Fort Drum Regional Health Planning Organization out of Watertown. This afternoon session is a new session that we're introducing this year called Hot Topics. So today you're going to hear from three fantastic presenters on 15-minute presentations such as Tele Dentistry, maternal and child and infant health, and physical therapy, all in the telehealth space and some of the work that they're doing. I do want to, of course, give a sincere thank you to all of our past sponsors. This is the 6th year of our virtual, or our now virtual, telehealth conference, and it would not be possible without all of the organizations listed on this slide. We hope next year we can reconvene in person, and you'll get to meet some of these folks. A few housekeeping items before we get started. You have been muted and your video should be off upon entry. To avoid an echo on your end, please make sure you've chosen either computer audio or phone audio and not both. For optimal viewing, we do recommend using side-by-side mode. To activate this, you would click on View Options at the top center of your screen and choose side-by-side mode from that drop-down menu. Use the Zoom chat to submit questions for the presenters or for AHI staff. We are holding questions until the end, and we'll be doing a moderated discussion at that time. Lastly, we are recording this session, and the recording and slide decks from the presenters will be on our conference website the week of October 5th to October 9th. I'm now going to introduce our speakers. So first up, we have Howard Reese. He has 30 years of telehealth and telemedicine experience dating back to his role as project manager for 9X Corporation in a telemedicine trial with 4 Boston teaching hospitals in the early 1990s. He helped 2 separate teleradiology companies achieve the status of Forbes Inc. 5,000 fastest growing private companies 3 times each. He joined the Tele Dentist as CEO in May of last year. Our second presenter you'll hear from today is Siggy Marmestein. She is a hardworking nurse leader, educator, and innovator. She is also a telehealth consultant with more than 65 successful telehealth implementation projects under her belt. Her role as a telehealth consultant is a culmination of a 20-year career in healthcare, spanning employers such as DaVita, Kaiser Permanente, USC, Adventist Health, and West Coast. And lastly, we have Nihal Golwala. She is a physical therapist working for Adirondack Physical Therapy and Fitness, PLLC, an outpatient facility in upstate New York. She has more than 10 years of experience in the healthcare industry and has developed a variety of innovative telehealth techniques to help her patients since the pandemic, including participating in virtual physical therapy research based on patient outcomes. I'm now going to turn it over to Howard to talk about teledentistry.
Thank you, Katie. And are you seeing my screen?
No. No, so if you click on that green share screen, there should be a pop-up window that comes up.
Yep. Still not there?
There it is.
Got it.
If you want to just do from beginning.
Yep. Here we go. Katie, thank you. Thank you, everybody, for sticking around on a Friday afternoon. Um, Next year back in Lake Placid, where I'm sure it's a beautiful day today. But happy to share with you what's been happening with teledentistry during the COVID-19 crisis. And, the one starting message is, please everybody, let's consider oral health as part of overall health. The teledentist has been pioneering virtual dental solutions. We have a national network of 300 dentists. We're working 24/7, helping patients that have dental emergencies. We have a HIPAA compliant telehealth platform, and the mission is really to be anywhere that a patient presents with a dental problem. So you ask, how do you do teledentistry, or what is it that you're doing? We remediate the problem. We will e-prescribe. We'll get a prescription sent to a local pharmacy, and then we can get the patient scheduled for an on-site next day visit with a local dentist if necessary. That was a little bit of a challenge during the height of the pandemic. It's a little easier now with offices reopening, but we really do intend to connect the patient with a dental home. We also offer a white label solution for dentists to offer teledentistry to their own patients. We're providing dental second opinions and starting to get also into educational services. Where can we do teledentistry? Like I said, anywhere that a patient is presenting with a dental problem. So there are over 220 telemedicine companies. We've spoken to many of them. We're starting to work with a couple. We want to be their dentists, and we'd like to be able to provide access through them to our network of dentists. We're working with benefit aggregators. We've recently stood up our first employer clinic. We're about to start working with our first group of hospital emergency rooms. We can work with mobile health companies, long-term care facilities, DSOs, urgent care, and then all the way down, to the home, where, again, certainly during the pandemic, that's where the great majority of our patients were. So we've been speaking all week about the impact of COVID-19 on telehealth, unprecedented increase in telehealth visits, the ability to do cross-state licensure. There is now the ability to prescribe controlled substances. We are not doing that. They've relaxed the HIPAA requirements. That's actually one requirement that I hope goes backwards in terms of wanting to make sure that all the platforms that everybody is using are very secure. And important for us, teledentistry is now reimbursed as a service. So the impact on the teledentists, our patient volume increased significantly. We found dentists swarming to our site, either wanting to join our team and to help us with our patients or to offer teledentistry to their own patients. And significantly, we've been able to contract with several major insurers, including Cigna and Anthem. So our service is now available to millions of their members through their portals. Now I'm going to share some slides from just one of the distribution channels. These are slides that we put together with Cigna, and I share their slides because they're a lot prettier than slides I could put together. But again, it really gives you an idea of what happened. So you can see there, a significant increase in consultations by week. We were averaging just, through the Cigna portal, 21 consultations per day. And again, these were 3 months numbers, the first three months of the pandemic. We did see a drop off after the very height of the pandemic, and we pretty much maintained about those levels. Monday and Friday were our busy day, but certainly patients appreciated the fact that we're available on Saturday and Sunday, or even on a Friday evening, when even if they're dentists, and if they have a dentist, wouldn't be open until Monday morning at the earliest. Took us an average of a little more than 4 minutes to connect a patient to a dentist. And the average consultation was a little over 7 minutes. So again, it's it's not a long conversation. The reasons why they were calling, you can see there, large percentage, they're calling with a toothache. They have an infection, a broken tooth, bleeding gums, wisdom teeth problems, problems with a denture, problem with a child that is teething. So all different types of reasons for calling. And in terms of the disposition, again, we are e-prescribing, either a antibiotic or maybe just an over-the-counter product. We will get the patient connected with a dentist when necessary, and you'll see just a small number where there were really emergency referrals, where the patient was instructed you really do need to, either get to an emergency room or an urgent care center. The great majority of the patients that we saw were millennials, probably not to be not unexpected. And after every encounter, we asked the patients to rate us. And you can see there, great majority of the patients were rating us on a scale of 5, on a 1 to 5 scale. We saw patients in every state in the country. Like you can see, the busiest states were California, Florida, and New York. Interesting asterisk there for Texas, where actually it's the only state in the country we're not allowed to do teledentistry. And one question we ask all the patients, which has also been interesting: how long has it been since you've seen a dentist? And this certainly got worse during the pandemic, but we're finding sometimes the patient's been years without seeing a dentist, so we suspect there might be something more going on than just that toothache that they were complaining about. Some of the quotes from the pandemic: this is not a political statement, but as a small company, it was nice to see the president and the vice president promoting telehealth, about the dramatic increase in Medicare telehealth services, and the vice president talking about the changes in regulation. Seema Verma, favorite quote: "The genie's out of the bottle." The advent of telehealth has just completely accelerated. One of my favorite quotes from the pandemic and working with the folks at Cigna: "We just got done in 6 days what usually takes us 6 months." So again, for a small company to be able to work with some larger ones, we were able to get things up and running very, very quickly. So where do we go from here? Big issue now for us is back to the office. Dentists are returning to the office, and we're talking to lots of them about how teledentistry can help them with screening of their patients, determining which patients do need to be seen immediately, meeting their patients before they're putting on the PTE and their masks so they can have a face-to-face relationship. We have just converted both of our pilots with Cigna and Anthem to long-term agreements. We're excited about that. We're adding additional distribution channels. We are doing fundraising. One of the big challenges we have is to create awareness. We need to know where, that we need people to know that we are there and this service is available. We are also exploring potential of international opportunities. In terms of new initiatives, I think this may be something that is going to be a new initiative for all of telehealth, but the move to e-commerce, that through telehealth systems, you can sell related products and services. So we're working with a company that has a solution for TMJ, another one that has a solution for dry mouth, and coming soon, we are actually about to start a pilot project with Procter & Gamble, and again, looking to promote Procter & Gamble dental products. So again, e-commerce with or without a prescription, I see this as a new dimension for all of telehealth. So pleasure to chat with you all today. I look forward to answering any questions, and I think we're going to do it after the next couple of speakers.
Excellent. Thank you very much, Howard. You can stop sharing your screen. I'd like to bring up Siggy. So Siggy, if you could hop on and you can share your screen.
Hi, everybody. Thank you so much. And I know a few of my friends are here today, so it's even nicer to have them here. So can you guys see my screen?
Yeah, if you'd want to just hide that one sidebar on the right. So
Yes, do that right now. Yep.
We'll be all set.
Let's make it all bigger. There we go. Sometimes he doesn't want to do that. Here it is. How are we doing?
Great.
Awesome. Well, my name is Siggy Marmerstein. I'm the CEO and founder of BabyLab Advice, which is a company that supports maternal child care virtually and remotely. BabyLab Advice started off as a pilot out of California with remote moms who were about 120 miles away from the medical center in Northern California. The 3-year pilot showed us that maternal child problems are, starting to be very unique, especially for rural community mothers and remote mothers. And so we decided to devise a telehealth program and some educational program for them. And from there, BabyLab Advice grew. BabyLab Advice is on a mission to pretty much improve the outcomes of every pregnancy, to give every baby a healthy start in life, to lower the healthcare cost, improve the women care access without increasing the stress, decrease the incidence of low birth weights in infants, and of course, empower women to advocate for self and baby, and of course, provide every mom with the individual support and education that she needs in her language, culturally appropriate. To do so, we first of all had to look at what are the issues that we see in maternal child care, and they are falling into a few buckets. Pregnancy, obviously we know that, and unfortunately we know that American women are a disadvantage compared to other women around the world, where we are 3 times more likely to die during pregnancy, delivery, or within 1 year of giving birth. Prematurely in the United States, in 2019, we had 500,000 babies admitted to the NICU, and we know that 1 out of 5 African-American babies will not make it to the first birthday. Access to care, well, 5 million women are living in maternity care desert, where there is no hospitals or any obstetricians that are available to them, creating a massive care gap that really needs to be, somehow managed. Postpartum depression, which has been, got a lot of media attention in the last few years. But most strikingly than anything, when we did our survey of 7,000 women, 85% of our parents reported feeling uninformed or underinformed about the pregnancy and delivery and infant care. And that is something that we, with all of that, really wanted to tackle. This all was in 2014 and 2017, and then COVID happened. And obviously, COVID really put a lot of pressure on the system to support maternal child care when women and babies are actually in the highest risk of getting COVID. With that, many hospitals who could shifted immediately to Zoom or other ways by treating the mothers, but others pretty much stopped a lot of programs altogether. And so, with the chronic disease management that comes with pregnancy, whether it's hypertension, diabetes, obesity, the genetic consultation that is required, and the pre and postnatal checks, there has been a lot of need to continue seeing those moms, but obviously that has been a challenge. Unlike any other disease process where people can say, okay, I can wait with my tooth, or I can wait with my colonoscopy, or I can wait with, other things that I want to do. With pregnancy, we cannot wait. We still have to take care of the moms, regardless of the fact that COVID is out there. And obviously challenges have been arised, which brought our company to a 400% utilization in the last 3 months. What BabyLab Advice pretty much did is following the Welcome Baby approach, which was being tested in LA and in the California area for many, many years. What really the Welcome Baby approach says is that we need to support moms a little bit more individually in between physician appointments. And to do so, we need to do it on one-on-one basis or with a group consultation medium. And so if you look on the right, it pretty much describes what does it look like when we see mom. And I think that in New York and others, you heard of the home visiting programs, which are very popular in the last few years. The problem with the home visiting program is exactly it. We need to visit the mom at home. And with COVID, that has been a serious challenge. We have taken the home visiting program idea, but we have done it virtually and found that it actually was more acceptable and compatible for the parents, extremely convenient for them. Obviously did not require nurses traveling into homes, reduce the cost of that need. And we were able to do everything, including oral care, which is wonderful to hear Mr. Reed talk about telemonitoring and family planning very successfully through the virtual support. In fact, in our program here in Los Angeles, we found out that virtually we can do more than we can do with the home visiting program, see more moms, that is. The idea is to really cover moms from preconception to early childhood. So everything from pregnancy intention, which is a huge problem in our country, you know, having those conversations about, you know, conceiving babies, spacing babies, talk about birth control options and others, all the way through pregnancy, and then the most important period, the postpartum time. And unfortunately, across the entire country, postpartum visits no-show rate is as high as 30% in some places, and 60% in others. Mom don't show up to postpartum appointments, which puts both mom and baby in very high risk for complications. So our ability to really see the mom throughout her entire pregnancy and postpartumly, creating that one unified relationship has shown in many of our data to be extremely valuable and reduce costs by millions. In our pilot alone, we reduced costs by $14 million. What does that look like in real life? It's have a two component to it, a SaaS application that can also, by the way, be approached through any internet connection. We are a WebRTC telehealth program. That means that you can just click from the web and see us. We have the service side and the technology side, but so we are a service enabled by technology, not the other way around. The technology is just the enabler of our work. And we create a monitoring dashboard that allows us to take data from moms, which is blood pressure, blood glucose, fetal monitoring and others, as well as the application, which allows us to interact with the mom. And we have multiple support services, lactation, social work, nutrition, virtual group education classes, support groups, nurse and nurse practitioner advice, and midwives and doula support. And with that, we created technology integration with a lot of new technologies that are coming to the market that allow us to also integrate with dietary programs, educational programs, different kind of monitors, and also remote ultrasound. On the educational side, we built a platform that allows us to do telehealth education live with classes for moms from all over the world and all over the United States. And that will be about contraception education, smoking cessation, talking about hypertension and diabetes, anything about, you know, preparation for birth classes, lactation classes, and obviously support group for maternal depression and anxiety. Our support groups right now, running about 200 of them a month. They are really well attended, and unfortunately many of them we have a waiting list. We are looking into increasing that program, and that program has been really on the rise since COVID, as many hospitals stopped giving those classes through the hospital systems. We really have a care schedule. We work with the provider and with the system, and that is a very important part of it. BabyLab Advice is what we call a physician extenders program. We extend the care that can be given in the clinic or in the hospital. Obviously, even of the best physician with the best attention can only have so much time to interact with mom, maybe 15, maybe 20 minutes. We are then will take over, if you may, on all the educational and support and emotional lead from the mom, but she will still be, if possible, see her doctor in the normal interval as, is requested by the insurance company or whatever it is that is the clinical guidelines for that specific mother. So, if the patient has seen the providers say, between now and your next appointment, we'll ask you to see BabyLab Advice, and we will start, do a good education, nutrition education. We'll bring her into her classes, into the support group, and then we'll see her postpartumly after she had the baby, and then stay with her until the baby is 3 years of age. And that has shown in many, many of our studies to just make a massive difference on cost and also reduce risk on mom and babies quite significantly. Obviously, the solution we provide creates continuity, coordination of care. It's very convenient for the mothers and for the parents. And again, showing cost saving. We are, again, not a medical providers. We are technology and non-medical providers, and we collaborate with the healthcare organization, insurers, employers, to educate expecting mothers and to really reduce the risk on them. The benefit of using BabyLab Advice program has been shown to in three really, economically, operationally, and strategically to any health organization. Economically, of course, reducing the risk and the higher need of care, reducing patients showing up in the ER, having a baby. Operationally, reducing the physician workload and the burnout rate, reducing the need to have more staff, rather less staff when we are augmenting the system. And strategically, of course, parents really do love BabyLab Advice. This is convenient to them, and they love using it. It reduces the stress on them to find childcare, for example, when they have to show up to a doctor's appointment. This is our results to date. We had 15,000 total encounters to date. We are growing significantly. We have shown reduction in C-section, readmission. Our satisfaction rate is 98% from both physicians and patients. We help moms to stay lactating and breastfeeding for a long period of time, and our depression scales are much more reduced. Our current partners are big names in the industry, Johnson & Johnson and March of Dimes. We are now working with the March of Dimes on becoming their telehealth providers. We recently signed a contract with Huntington Hospital here in California, and we're working also globally in Kenya and Uganda. We also white label our application for 501(c)s to help them serve their parents. And so we also do some white labeling of our application on capacity to hospital system who want to use our system and our knowledge, but just want to provide that care by using their providers, which is absolutely fine by us. Our team is a very, experienced and diverse. We've been in healthcare, all of us, for many, many years, in telehealth for even more time. And we really do know how to take this idea forward and scale it and make it so it's very successful. Thank you so much for your time today, and I'll be more than happy to answer any questions about BabyLab Advice, and definitely looking for clinical partners as I think moms and babies truly need us.
Excellent. Thank you so much.
Thank you so much.
We will hold questions till the end. So last but certainly not least, we have Nihal Golwala. So if you want to hop on video, we'll get you queued up. Excellent.
Hi everyone, this is Neha Golwala, and I'm a physical therapist for last over 12 years, and I work for Adirondack Physical Therapy and Fitness, which is like outpatient based clinic for orthopedic, neurological, and women's care. And basically, I'm a manual therapist, but I'm like, uh, since like December 2019, I'm kind of like a big supporter of telehealth physical therapy because it's been helping patient and physical therapists both in terms of like flexibility and also the care. Um, so today I'm going to present on the expansion of the telehealth physical therapy during the transition to the new normal. The scope of physical therapy in the inpatient and outpatient setting was clearly defined that, okay, it's a manual therapy, or you're working on like balance, or you're working on gait, or you're working on mobility, you're stretching the patient, or you're like trying to work on some soft tissue mobilization. But the telehealth has been practiced in the field of physical therapy for a long time, like it's been last few years, but it was mostly cash-based or preventative-based because of the insurance coverage. But since the COVID-19 came into the play, it created a significant impact in the mode of delivery of healthcare system, including physical therapy. Virtual physical therapy created a huge difference in patients with the pain, injuries, and or surgeries during the pandemic without endangering their lives. Since COVID-19, most or all insurance providers understood the scope of virtual physical therapy and cover for the same. The objective of this presentation is kind of like, first thing is to understand the scope of practice of a licensed physical therapist in the virtual world. As I said, every state has a different guideline for the practice of physical therapy, mainly in the inpatient and outpatient. So for the telehealth physical therapy, they have developed certain guidelines, and physical therapists must adhere to any state laws for providing telehealth physical therapy treatments. During COVID-19, many states relaxed their guidelines for telehealth physical therapy, and insurance started covering for telehealth because of many reasons. First thing was like temporary closure of outpatient physical therapy clinic during the pandemic. Our clinic reduced our hours just because of the pandemic, and the all non-essential surgeries they had to put on hold during the COVID-19. So we weren't getting any inflow of patients from like different orthopedic surgeons and like other hospitals. So like many therapists, they were furloughed or like the clinic shut down during that time. So telehealth created the opportunity for the physical therapists that they can still work from home and help people who are still suffering from pain, or they have like injuries or surgeries. That's the second point too, that patient require physical therapy for the recent surgeries or injuries. Like if patient had surgery prior to the COVID-19 and prior to closure of all non-essential surgeries, they still require physical therapy for their mobility, for their strength. And if the outpatient clinics have been closed down or they have reduced hours, they had hard time like receiving physical therapy. So telehealth has been the great opportunity for the patients to receive physical therapy via video calling, and still they can recover from their surgeries and injuries. Inability of patient to receive physical therapy in the clinics due to increased risk of infections. There are patients who have pre-existing conditions like they have COPD or asthma, and they don't want to go to clinic because they don't want to catch any kind of infections. So for this kind of population, telehealth has been proven great opportunity to continue their care via video call, and still they are recovering from their injuries or surgeries. And also telehealth provides flexibility to the patient and physical therapists too. They don't need a child care. They can just receive physical therapy at home and at their own convenient time. And you don't need like too many equipments to have like receive physical therapy at home, because during the pandemic, we realized that patients can still use home-based equipments like you can use bowls, you can use like a ball, and we can still work on your strengthening and stretching using the towel, working on the posture. And also like we were helping like patients through providing them sometimes overhead pulleys or like TheraBand. We were just sending that to that patient's home via like either like delivering to their houses, or we were just kind of like sending them by the mail. So they were able to still do the same physical therapy as they would do it in the clinic and getting the same results. So during this time, we have quite a few increased number of people to work via telehealth because of insurance coverage and the patient's availability, and therapists were available to do the telehealth physical therapy. Understand the opportunities to work in different states at the same time. So availability of temporary license, like during this pandemic, many states like New Jersey, Maine, Vermont, New Hampshire, they provided temporary physical therapy license with no cost. So all you have to do is just apply for that license, and then they will sending you an email with the license verifications. And I think it's going to be new normal now onwards that physical therapists will be able to work in multiple states at the same time because they will be having a multiple state license. So that's one of the opportunity, if you like, they can work from their home to different states at the same time. Flexibility during the public health emergency, CMS and other insurance are allowing physical therapists in private practice to provide telehealth services from their own home without reporting their home address on their insurance enrollment, while continuing to bill from their currently enrolled location. So you can still bill from your clinic location, but you can work from home without you have to provide the service location is your own home address. The insurance coverage. Most insurance in different states are covering for physical therapy services since pandemic. Workers' comp, no fault, Medicare, all insurances, they are mostly covering for the telehealth physical therapy services since pandemic. And I think they are going to continue because this is going to be a future for physical therapy for sure. Liability insurance coverage. HPSO is covering for telehealth physical therapy in multiple states with no additional cost since pandemic. Physical therapists must need state license verification for liability insurance coverage. So if you have a state license like New Jersey, New York, and the other different states, all you need is just the license verification. And HPSO was covering at the same, like for the same price, they were covering for all state liability insurance for the physical therapist. That was the great benefit. Understand the HIPAA laws and compliance. HIPAA laws are very important. They are basically patient privacy law, and then patient must provide a written consent to receive treatment via telehealth with the right to refuse and be given an opportunity to be seen in the office. Physical therapist must perform the treatment in the room and area where no family is nearby. So you have to have enough light, no background noise, and no families like roaming around. Even if you can do it from home, you have to be in the quiet environment and respecting patients' privacy. Use of telehealth platform. Before pandemic, only secure platforms like Zoom or Doxy.me were allowed for telehealth physical therapy. But during this health crisis, many people, they didn't have any access to, like, many old people, they didn't know what is Zoom or what is the app, how to download it. So like they relaxed some of the laws for like the platforms that, okay, clinician can use everyday application that allow for the video chat, such as Apple FaceTime or the Skype, because most of the people have iPhone or they have Samsung phone and they can easily download Skype. But however, HSS and the Office of Inspector General and the Department of Justice will monitor for healthcare fraud and abuse, including potential Medicare coronavirus scams. You still have to maintain some HIPAA privacy, that you're not recording certain things unless and until patient is providing written consent. Now, understand the billing and coding for different insurance provider. Since the pandemic, most insurance, including Medicare, is covering for the telehealth, physical therapy, and they paid at the same rate as in-person therapy for the new and existing patients. The eligible CPT codes for Medicare and most insurance in New York State were 97161 to 97164. They were basically evaluation codes. And the other 97 codes, like a therapeutic exercise or like neuromuscular education or partial education or grade training, those codes were the same as you bill it on the regular basis, except for the Fidelis Care, who required to bill 99441 to 99443. They were the only different ones. But you must need to include the modifier 95 or GT and the place of service, that is 02, that is your home or different than your clinic, along with the CPT code for the billing of telehealth services. Since the pandemic, some insurance, such as United Healthcare, they waived copay for in-person and telehealth physical therapy services. So many patients were able to receive physical therapy because they didn't have to pay copay. Many patients had questions in the beginning, like, how would you do physical therapy online? It's more like, okay, you have to use the stimulation, you have to use the heat, you have to use like a stretching. How would you do it without doing any kind of manual work? Uh, but physical therapy is not only about the manual work. It's a lot more about the postural education, a lot more about the muscle awareness, a lot more about your own body awareness, and also working on some strengthening and stretching exercises that you can utilize the same home tool. All you need is like the proper communication with the therapist, and then before like a visit, we used to provide the patient like all the information, what to expect, what we are going to do, how am I going to evaluate you and help you with the treatment, and what are your expectations. So based on that, we can decide the goals. Okay, we are working on like range of motion, so we'll need this big ball so we can try to work, and we'll need a bed, or we'll need like an open space, or we need some area when there are not like too many pads or clutter around so you don't fall, because you need to have like a policy for emergency situation. Like if what if like you're working on the patient and patient is falling, and how to handle the whole emergency situation, because you're not right there with the patient. So there is a lot of communication with the patient through the email, through the like phone call, just to make sure that this is what we will need it during the treatment. This is what is your condition, we are going to evaluate you first, we are going to work on this thing first, and like what you will need it, you will need this much of room here, or you will need internet. Okay, we are going to use this platform to do the treatment. And once like the whole treatment is done, you can document into like a WebPT or any other like you can use um, like physical therapy platform for the documentation, so your biller can bill and then you can get the insurance reimbursement unless you do the cash based. And there are techniques like you don't need to use at all manual therapies. Like for the spine, we use McKenzie technique, where you can evaluate the spine without touching a patient, just through the range of motion, just through the symptoms. And we try to explain it to the patient, okay, if you have a back pain, how we are going to evaluate you, how we are going to treat you, and what are the postural like precautions you have to follow, just to enable to reduce that inflammation and get better during that time. And also we were providing the lumbar support if patient was in a need for that. And as I say, like the overhead pulleys if someone had shoulder surgeries, or therabands if patient needed for the strengthening part. So that was like a whole like a new way of learning, and how like patients were also getting like more confidence that, oh yes, physical therapy can make a difference via telehealth. It's not all about just the manual work, and they were able to see the results. Also, they can receive physical therapy anytime during the day, like at night, in the evening, over the weekends, when the clinics are normally closed. And during the pandemic, some insurance like Fidelis Care removed the authorization process and continue physical therapy based on medical necessity. Most of the insurance removed the authorization process for the New York State, except for a few of them still required it. So that helped us with reducing the paperwork, as we were not in the office, so we didn't have the fax machine, or we didn't have any kind of like printer or anything like which is required. Like you have to like make a printout and you have to fill out the form and fax it. So that reduced a lot of documentation on that aspect, and then patients were able to receive the care they needed. And it was a great experience, and I'm like really hoping that will become the future for patients and many. So thank you so much, and I'm really happy to answer all the questions if you have regarding telehealth physical therapy.
Excellent, thank you. You can stop sharing your screen, and Howard and Siggy, if you guys would please pop back on. Excellent. So we, folks, if you would please put your questions into the chat. One question came in for you, Siggy, from Jessica Perry. Do you offer classes or support programs specifically for fathers to be?
Absolutely. So first of all of our classes are being attended usually by the partner and the parent, both. So sometimes we get fathers, sometimes we get other significant others showing up to the classes already. But we do have 3 support groups specifically for dads or significant others. And one of them is the preterm lost baby support group, which is unfortunately, you know, very highly used, which is really sad.
Okay. I actually have a question for you, Siggy. You mentioned that you have a white labeled product for, I'm assuming if health systems want to take the BabyLab Advice platform and use it on their own, they can. Do you see that more and more health systems are adopting that white label program, or more just, you know, new families, mothers to be, fathers to be leveraging your platform on their own?
We've seen a combination of different kind of business, you know, ideas that comes from it. Some people want a certain part of a program. So they say, we want your lactation or your classes, but we don't need everything else. We build BabyLab Advice to be modular. That means that you can take whatever the health system or the physician or the group needs, and they don't have to take the whole enchilada, right? They can just take a piece of it. And we did that in order to be more adaptive to what it is that is the need at the time. Since we're working with a lot of international group, we find that the international group obviously want a white label BabyLab Advice. But here in the United States, we've seen like half and half. We have white label that uses some of our services, so it's type of a combination as well. So they're really depending on, for example, March of Dime is white labeling BabyLab Advice, but they're going to be using our classes.
Okay. Ray Babowitz has a question for you, Siggy. Does BabyLab Advice have any history of working with WIC teams?
We do not. We the problem with WIC specifically, at least here in California, we have worked in lactation very heavily, but here in California, WIC has not has been using Zoom to continue the practices, so they have not turned to us yet to do with the work that we are doing. But WIC is definitely a place where we should be working with them. It's a little bit more, I would say, political and a little bit difficult.
Okay. Neha, question came through, it just came through privately. Do you see any of your clients still using telehealth post-COVID? Do you think you'll keep that as an option going forward?
Yes, I am still treating patients via telehealth, and that's going to be definitely, I'm going to continue working with the, via telehealth. For many people in different states, in the same state and different states as well, because I'm trying to help many state athletes and also postpartum and pregnancy women right now. So we are working with different players for the assessment for prevention of injuries, and also just generalized strengthening, or also after injuries and during the pregnancy if they have any kind of problems, or postpartum and any other work injuries, or we do see all kind of cases, and we are going to continue working with the telehealth at this point. Yes.
Excellent. Another question came through privately, and this is for all of you, so I'll start with you, Howard. How can New York State help support these more specialized telehealth programs?
Well, in terms of the state, anything they can do in terms of awareness, celebrate success stories, just getting the word out that this is available. But maybe one thing to get out and share with my panelists, I see us all as telehealth subspecialists. One day somebody is going to roll us all up, and there'll be one-stop shopping that somebody can go to on a common platform, and you'll be able to get access to all of those different specialties. And I'd be curious to know from Siggy and Neha if they envision that as part of the future, and if that might provide a significant benefit also.
Absolutely. I think that that's definitely the future of telemedicine in general, but definitely, of subspecialties within telemedicine. The state of New York, and like every other state in the United States, have a severe maternal child morbidity and mortality. The state of New York need to look at that and decide where do they put the programs at. And so if the state of New York want to support that program, I know the NIH recently got $360 million in grants to all the states to look at maternal child care, especially in the African American community. And I'll be more than happy to partner with anyone who want to partner with us about implementation of such programs for those mothers.
And yes, I really agree with both of you that collaboration with different field would be the great opportunity for the patients. So they don't have to go everywhere. They don't need to find oh, where can I find provider? If everybody's together, that would be the great thing that they can just find them right there. Okay, I need this, then oh, you can find here like this, or I need this kind of services, you find, or the provider can refer them to different provider within the same practice as well. So they don't have to go and find someone else. If someone is having TMJ issues or having the neck pain at the same time, so dentist and physical therapist can definitely work together in that aspect. And same thing with the maternal care and pregnancy postpartum, PTs can work on the pain management or some musculoskeletal pain management or the labor positions and different other aspect how to cope up with the postpartum pain or different other conditions, and how to carry a baby or how to carry stroller or how to go back to running, because many moms are into a lot of running lately. So that is kind of one of the major thing that if they collaborate together, that's the best thing to do it for the future, and it's good for patient and provider both.
Right.
Excellent. I didn't really think of how these three specific specialties really do intertwine in so many ways. So it kind of worked out well that the three of you are on this panel.
Exactly.
We do have one more question that came through. So if anybody has anything that they want to submit, now's the time. This one's for Howard. So teledentistry, when you say that to people, I say that to my friends, oh, we have teledentistry. They think that is the wildest idea, but it's here, right? So what do you see for the future of teledentistry?
You look back a few years and you say, we've come so far.
Mm-hmm.
Again, in terms of the future, I do see teledentistry being incorporated in, working with other aspects of telehealth. I do see the ability to use, if we're looking at the future, looking at, the use of artificial intelligence and how that's going to work in conjunction, and, oral health being a very important component of population health. And we're seeing new things all the time. I mean, talk about, the elder care population, talking to a company that has developed a program where they can go into a nursing home, scan the dentures of all of the residents, and if a denture gets lost or broken, they can replace it using 3D printing. I mean, talk about the future.
Yeah.
This is happening today. So,
Right.
we're not that far away. It's really, taking advantage of the technology and working with all you smart people out there, that are, delivering these types of services to your patients, and, working with them. And, it's all about patient care. And, the better we can do to solve the patient's problems, reduce costs, make it easy to use, all part of the future.
Excellent. Well, there are no other questions, and we are about at the top of the hour. So I would say that our first year trying a Hot Topics panel went very well. So thank you to the three of you for taking the time out on a Friday afternoon for speaking at this conference. This is our final session, so our telehealth conference week is now over. Next week, we will be kicking off our AHI Leadership Summit week with a big focus on more population health than virtual care like this week. So I hope that you'll all join us 10 a.m. on Monday for our next session. Any closing thoughts from any of you before we sign off?
Thank you so much. It's been incredible.
Thanks to you and the whole team, Katie. This, needed to pivot, and you guys did it well. And, like I said, next year in Lake Placid.
That
I
would be
hope so.
great. I'm up for Lake Placid.
Me too.
Thank you
All
so
right.
much.
Well, have a wonderful day, everybody.
Thank
Thank
you.
you
Yes.
so much.
Thank you. Good job.
Thanks,
Have a
Katie.
good weekend. Bye.